they found out that I had congestive heart failure and that I needed a pacemaker. Wow. I was just like a family, one of the staff members, put it that way, because that's how often I was being admitted there. Seems like on my birthdays, the 4th of July, Christmas, New Year's, I'd be in the hospital.
And as best we can tell, this is the first time the shock was actually inappropriate.
Exactly. And
Mr. Rust is a gentleman who was sent to us because he had bad heart failure, and part of the issue was that it was difficult to control his heart failure. He kept retaining fluid, he would swell up and end up having to be back in the hospital. And so we met him, and our task was really to try and help him out and see what we can do to try and prevent him from keep getting these fluid built up and having him end up right back in the hospital.
I kept just going back constantly 3 times out of a month for the same problem. I'm not paying attention or taking heed to what I'm supposed to do as far as my health. That's good. Let's see the legs.
It should come as no surprise to anyone that areas that are economically depressed also suffer from a lot of the social ills that make people incredibly good candidates to get readmitted. If there's poor literacy rates, if there's low levels of education, if there's low access to great quality food, if people can't afford their medications or have lack of social support, all of which happen unfortunately across the board in the U.S., but happen predominantly more commonly in areas that are economically depressed.
This is a matter of life or death. And like I said, I didn't take it serious, you know. So then I said, well, that's it. It got to be a better way.
Anyone who thinks that hospitals are the sole proprietor of the risk in this equation fail to understand the complexities of 30-day readmissions. Hospitals could be part of the solution, but anything that falls short of patients being actively engaged in their own health care, in understanding the risk, in managing the risk along with their physician and the hospitals. If people don't understand that, then I think all solutions will fall sorely short of where they need to be.
All right, Mr. Russ, looking good. What I'm doing now is working out okay, you know. So, I mean, my weight, I haven't picked up any weight since I've been out the hospital, and I've been in the hospital for almost a month or so, and my weight is still the same, you know, and there's no fluid on me. I ain't got to run back up in here during the month because of something that happened, you understand what I'm saying, that I'm not doing right, that I'm doing wrong. So long as I'm doing the right thing and maintaining the things that I need to keep, you know, my health on this proper perspective, then I'm satisfied. You know, that's all I can do. What they asked me to do and what I needed to do within myself. That's it.